That would be awesome. But here's what our agenda is for today. Um, Sometimes when I very first meet with people when they're getting started with this software, it's a really quick call, and sometimes I tend to go through things really fast. And so what I wanted to do today was just slow it down. I want to write a narrative with you guys from start to finish, and just go through it a little bit slower so you can see how the software can work for you to make it easier to write nice narratives. Um, so that being said, just a little idea about my personality is um, my personality is I like things in big picture and I like to run through things really fast. I'm not a real detail person. So that's why I initially kind of just big picture, broad strokes, like here it is, figure it out. But for the sake of everybody else who is not like me, I'm going to take it down slow and just really go through the details so you can see how it's written. Is that cool with everybody? Okay. So if it's too much for you and you're like, oh my gosh, I wish you would just move on, um, just sit tight and absorb it all in, or play on your phone in the background if you need to. But for the sake of this, I want to really slow it down so that people don't miss anything. Also, I'd like to know, just from everybody that's on here, uh, without using this software, like how long have you guys, just put in the chat, how long have you been writing narratives for OWCP? Like, I'd like to know kind of just your experience with how long have you been doing this for? Okay, so 2 years. So you've got some good 2 years. Good. 3 years. Okay, awesome. So you guys have some background knowledge on what a narrative is supposed to look like. So we're not really teaching you how to write a narrative. I'm just teaching you how to utilize this software to write one. Okay, that's good. That helps me. Okay. Nevertheless, we're still going to slow it down and be a bit detailed with this. Yeah, 3.5 years. She's got experience. I knew that. Okay, good. So, and feel free, like as I'm going through this, if you have a question, just type it in the chat and I'll try to keep my eye on it. So if you need me to go back or like repeat that or something, just type it in the chat there. And I think there might be a raise your hand feature. If you figure out how to do the raise your hand feature, you can raise your hand and then I can check on you. Okay. Okay. So, uh, and here's another question. Does everybody on here use Quick EMR for their software? Is that pretty safe to assume? Okay, awesome. Okay, good. Because I'm going to actually go through in real time, like even like putting what comes from the AI software into your EMR as well, and just show you how I do it. Because I still help my team write narratives for one of my locations. So I'm in this on the daily utilizing it as well. So I'm going to share my screen. Let's see here. There we go. Okay. Perfect. Okay, everyone see my screen here? So this should be what this is our dashboard, but this should be what your dashboard looks very similar here. And today I'm going to focus just on one feature, which is the new injury narrative feature. So this is just writing a new injury narrative. So what we're going to do is we're going to go to this button here, new injury narrative, and then these are the blanks we're going to fill in. So if I'm in my office and we're writing a narrative, I'm then going to my quick EMR. And this is my patient here. It says temp here, but really this is going to be John Doe. John Doe is a low back CA-1 and he's a mail handler. And then this is the intake that my case manager got from him over the phone before he came in. And so it just, Mr. John Doe reports that on January 5th, he was injured while performing his duties as a mail handler. He states that his job involves loading and unloading packages, as well as transferring heavy mail bags and parcels from conveyor belts to shipping pallets. On the day of the incident, Mr. Doe was lifting a large package, which he estimates weighed approximately 75 pounds from floor to cart. While lifting the package, he felt a sudden pop in his lower back, followed by tightening sensation and difficulty standing upright. Shortly thereafter, he began to experience discomfort radiating down his right leg, along with numbness and weakness. Despite the symptoms, Mr. Doe, sorry, I need to change his name here, completed his shift, but reported the incident to his supervisor at the end of the day. By the following mornings, his symptoms had worsened, prompting him to seek medical evaluation. He reports ongoing discomfort, bending, lifting, prolonged standing, walking due to his condition. So I'm going to copy that. And then I'm going to my new injury narrative here. And I'm pasting this in description of injury. Okay. And then we'll go ahead and fill this in. So we have Mr. John. He is a he, him. His injury happened on January 5th. And his job description is he is a mail handler. This is a CA-1. And our reference number is going to be his last name, his case number, which I just made up, and the date that he's coming into the office to be seen. Okay. So now we're going to go into our EMR and get his exam findings. So we did an exam on him, and the exam we have of his lumbar spine is this. So he has tenderness and palpable muscle spasm, paraspinal is L4-5, limited range of motion, and flexion and extension. He has a positive straight leg raise. He has, which is reproducing radicular symptoms down his right leg. He has decreased sensation at the L5 dermatome, weakness and dorsiflexion on that right foot, and reduced Achilles reflex on the right compared to the left. So we're going to copy that, and we're going to put that in our exam findings. Now we're going to get our imaging findings. So it just so happens that he had an MRI on January 7th. He has a herniated disc at L4, L5. And he also has evidence of lumbar strain with soft tissue swelling in the paraspinals. So we're going to copy that, and we're going to paste that in. Last thing we need is our diagnosis. If we come here, looks like we diagnosed him with intervertebral disc disorders with radiculopathy and that sprain strain of that lumbar spine. So I'm just going to copy that. And we're going to paste that in here. Okay, so we have all the information that we need to start our narrative. Any questions at this point? All good? Okay, so we're just going to hit generate narrative. Now remember, the first bit of information that this is going to spit out is a very concise summary. It is not going to be a full narrative. Reason being that AI at this point in time is not capable of producing enough information from one inquiry. It limits the amount of, they call them tokens per inquiry. So it's going to be very short, concise. So it's from that concise one that we then expand to create our narrative. And I'll show you how we do that. Now, however, being in practice, it's okay to say, this is up to your discretion, that if a patient comes in and they already have an accepted case and they're just new to your clinic to start treatment, but their case is already accepted, you're not adding any other diagnoses, you're fine with what they have, you can use this narrative is probably fine. Their case is already accepted, you're not trying to ask someone for more things. You could probably just copy and paste this in. But if it's not and you're trying to create a really good narrative, then no, we want more information. So up here at the top, this is the info we put in. The assistant here, this is what the assistant is telling us, and this is that narrative that is short. Okay? First bit of information is their job description for the mail handler. This is actually fine. I'm going to copy that, and I'm going to come into my narrative here, and I'm going to put that job description. So there it is. Job description there. The next thing that my EMR here, my narrative template, is telling me I need is a medical description of injury. So medically, what happened to this patient? So we're coming to our narrative. The second thing that the bot spits out in that initial is the patient's description of injury. It kind of rewords it. I think what I have in here is fine. I thought it sounded good, but if you wanted to change it up and make it sound better, by all means, read this and feel free to change it if you like. But my main thing I'm focusing on is this medical description of injury. What we're looking at here is medically, how are we describing the mechanism of what happened here to Mr. Doe? What this says here is much too short and concise. So it's just from a medical perspective, this is a direct result of biomechanical stress. He felt the pop. So I'm going to expand on this no matter what. I'm coming down to the bottom, and this first prompt, rewrite medical description. I'm going to click it, and it's going to populate down here. Will you rewrite the medical description of injury with more detail, including all areas of complaint, explaining the mechanism of injury related to the incident that happened? And I'm going to hit send. Okay, so here's what we have. On January 5th, John Doe, while performing his duties as a mail handler, sustained a significant injury to his lower back. The incident occurred during the lifting of a large package estimated to weigh approximately 75 pounds from the floor onto a cart. This action required John to engage in a deep squat, utilizing his lower back and leg muscles to generate the necessary force to lift the package. As he began to lift, the biomechanical forces exerted on his lumbar spine exceeded the physiological limits of his intervertebral discs and surrounding structures. The sudden pop John experienced in his lower back is indicative of an acute lumbar disc herniation at L4, L5 level. This herniation occurred as the nucleus pulposus, the inner gel-like core of the disc, was forced through a tear in the annulus fibrosus, the tough outer layer, due to the excessive compressive and torsional forces applied during the lift. The herniated disc material impinged upon the adjacent nerve roots, specifically affecting the right-sided nerve root, leading to radiculopathy. This is evidenced by the discomfort radiating down John's right leg, accompanied by numbness and weakness, which are classic symptoms of nerve root compression. Furthermore, the lifting maneuver placed additional strain on the lumbar paraspinal muscles, resulting in strain of the muscle fascia tendon of the lower back. The mechanical stress of lifting such a heavy load led to overstretching and microtrauma of these soft tissues, causing notable tenderness, palpable muscle spasms, soft tissue swelling in the paraspinal regions. This muscle strain further contributed to the unlimited range of motion and stiffness observed during John's clinical examination. The positive straight leg raise test on the right side of 40 degrees, which reproduced radicular symptoms down the posterior right leg, further corroborates the presence of nerve root impingement. Additionally, the diminished sensation along the L5 dermatome, right-sided weakness with dorsiflexion, blah, blah, blah. In summary, the mechanism of injury involved a combination of compressive, torsional, and shear forces applied to John's lumbar spine during the lifting of a heavy package. These forces resulted in the herniation of L4, L5 intervertebral disc and subsequent nerve root impingement, as well as strain of the lumbar paraspinal muscles. The clinical imaging findings provide a comprehensive understanding of the injury's pathophysiology, directly linking it to the lifting incident on January 5th. I like it. It's better than anything I would have been able to come up myself in that quick amount of time. So I'm copying that. I'm coming in here and I'm going to the medical description of injury and I'm pasting it. And now that part is done. The next important part we need in our narrative is scrolling down this medical opinion and diagnosis statement. So coming back to our session here, if we come up to the original thing it spit out, this medical opinion diagnosis statement right here is much too short. It's got a one sentence medical opinion, and then each diagnosis just has like 2 sentences and a conclusion. Obviously, this needs to be more detailed. So we're coming down to the very bottom and we're hitting this prompt number 2. Rewrite the medical opinion and diagnosis. So it's going to populate here. Can you rewrite the medical opinion and diagnosis statement with more detail, expanding on each diagnosis with the definition, the mechanism of injury related to the incident, and pertinent exam findings? Send. So I want to have a strong medical opinion, and then I want to have each diagnosis. I want to define what that problem is. I want to recap that medical or that mechanism of injury, and then I want to show the exam findings. So Here we have a better one. So in my medical opinion, the injury sustained by Mr. Doe is directly attributed to his occupational duties as a mail handler, specifically lifting incident on January 5th. The following diagnoses are supported by clinical and imaging findings. So the disc with radiculopathy, the definition involves displacement of the disc, resulted in compression of adjacent nerves. Radiculopathy refers to the neurological symptoms such as discomfort, numbness, weakness that occurred due to nerve root compression. Mechanism of injury, again, we're repeating. During the lifting of the package, his spine was subjected to excessive compressive and torsional forces that caused the nucleus pulposus to herniate through and tear through the annulus fibrosus, leading to impingement. The biomechanical stress exceeds the limits. Exam findings, the positive straight leg raise confirms it. Additionally, the diminished sensation. And then we have our sprain strain, the definition of what that strain is, overstretching and tearing of the muscle fibers. We have the mechanism of injury, lifting the package, placing that stress on the muscles, sudden exertion required to lift, the exam findings that support it, the tenderness, the muscle spasm visible on MRI, the limited range of motion. Then we have these diagnoses are directly linked to the lifting incidents on this date, as the biomechanical forces involved in the task exceed the limits of his lumbar spine and surrounding structures. Clinical and imaging findings provide clear evidence as to the causal relationship. So I like it. Here's one thing that the bot has been putting a lot of these like little number signs and stuff like this. I don't know. I don't get everybody's opinion. Like, do you love that or do you not? I have been sometimes coming down and saying lately, will you rewrite, without the numbers and stars, and just send. And then it'll just retype it without all the numbers and stars in there. I don't know, sometimes, when we deal with these claims examiners, like reviewing things, I just get in my head. And sometimes at first I was like, oh, I like all those because it's going to draw their eye to it, make them know that that stuff's important. And then I started getting in my head and I was like, what if they like think I'm being like facetious and rude and being like, I don't know, and it irritates them. So it's up to you. But I like this. I'm going to copy it. I'm coming over here and I'm going to hit paste. We have a question. Does OWCP comment on those characters or not? I've never had anyone say anything about it, but I don't know. I guess lately I've been writing a lot of narratives and I started getting in my own head about it. And I was less like, I don't know. Maybe I have the kind of personality it might kind of peeve me off. I was like, who does this doctor think he is? Thinks I can't read? I don't know. But that's just me. So I like that. It's a good medical opinion diagnosis statement for those. So the next thing is going to be our medical summary and causation. Medical summary and causation is, again, like we have enough here. It's like repeating ourselves. I'm just going to, and let me say it again. Yes, all this stuff happened to this dude. So prompt number 3, will you rewrite? So since it's already done these other prompts, I don't have to put a lot of stuff here. Can you rewrite the medical summary and causation with this same detail? And let's include the 5 elements in there. I'm going to go ahead and say, and leave out any and stars. Send. So let's see what we get here. Okay. So now we have a medical summary and causation. In summary, his injury is a direct consequence of the physical demands of his job. On this date, performing his duties, he was required to lift a heavy package weighing 75 pounds. The task involves significant stress to his lumbar spine, leading to herniation of the disc. Compressive and torsional forces exerted during lifting it exceeded the limits of his disc, resulting in displacement of the material on the right-sided nerve root. This caused radiculopathy characterized by discomfort. Additionally, the lifting maneuver placed undue strain on the lumbar spine, resulting in strain, mechanical stress, microtrauma of these soft tissues, evidenced by tenderness, muscle spasm, limited range of motion. The MRI findings further corroborate the presence of disc herniation and muscle strain. The clinical imaging findings unequivocally support the causal relationship between John's job duties and diagnosed conditions. Therefore, it is imperative that his claim be accepted based on substantial evidence presented. Then this claim fulfills the 5 elements required to accept for acceptance. There are 5 elements that substantiate the claim, and it's going to say number 1, timely filing. Yes, he filed it on time. Number 2, yes, he is a civil employee. Fact of injury, it occurred on this date, it is well documented, reported. Established factual occurrence of the injury, the diagnosis of the disc and the strain are directly related to the incident, providing the necessary medical diagnosis. Performance of duty, it occurred while he was performing his job. Causal relationship, there is a clear medical connection between the injury and his work-related activities as evidenced in clinical imaging findings. The biomechanical forces involved cause this. Diagnosed conditions, establishing the causal relationship. So basically, I like these. Ever since we started adding the 5 elements at the end, we've gotten faster claim acceptance. And I think it just takes the brain work out of it. It's their job to find these 5 things in our narrative report. It's all in there. And then at the end, let's just recap it and show them that here's those 5 things. And I think without all the stars and hashtags, I think if there's like a lot of stars and hashtags here, they might be like, okay, got it, but this is just a little better. Now we're just going to copy and come over here and we're going to paste. How many of you here like to again list the diagnosis in the summary and causation? Do you guys like that, or yes or no? Because one thing I noticed in here is we don't repeat the diagnosis, we just say in summary. So if you did want that, what I would do is say, okay, this is great, but I might say, this is great. Can you add the diagnoses in list form to this, as well as a summary for each? Okay, let's just get that question mark there. There we go. And let's just see what it looks like if I add that. And what I'm asking is I'm asking it to add that just to this section, this medical summary and causation. There we go. Okay, so I have this same blurb that I had at the top, but then I'm relisting the diagnoses and I'm summarizing what the diagnosis is, in that the injury was directly caused by excessive forces. Another summary of what the strain is, and then the findings that corroborate it. I like that better. Just a little extra. You know how they like us to you just keep repeating it. It's repetitive, but it's good. So maybe I'm going to do that instead. And let's paste that in there instead. Okay. Hard work of this patient's note is done. Then the last thing is to come in and, are you recommending anything for this pretend guy? We're recommending some trigger point injections. We filled out a CA-17 with restrictions. We're recommending an LSO brace, a TENS unit. We spent face-to-face time with this guy, and we're recommending PT. But I would say, unless you guys have any questions, that his narrative is done. We can see what it looks like. What if we hit print and we just looked at that? What does that look like all together? And then here's our nice narrative. Job duties, description, our medical description of what happened, our exam, our medical opinion with each diagnosis, our medical summary, again, recapping what happened, his diagnoses, the 5 elements, our plan for this guy. Well, what do you say? Is he going to get better? Yeah. And that's that. Okay, so we've been at this for 20 minutes. Once we started, a little past 20 minutes, and we even read it all together, copied and pasted. So that's pretty fast. So does anybody have any questions with that? Seem pretty simple. Is this the experience you guys are having? Is this, or are you guys doing anything different? Do you guys want to see another one? Do you want to see maybe a CA-2? More elaborative but similar? Okay. Has it had effect on our case acceptance rate? Um, I would say so. I mean, we've used this most of the time. I don't, um, we had a pretty high acceptance rate before. I think it speeds it up. Like our cases get accepted. Um, if I had any cases, Troy, I believe in our both our offices, I've maybe had 2 in 2 years not get accepted at all. And it's because the patient quit. Like the patient was tired. Like their first one got denied, and the patient was like, look, I'm out. I don't even want to do this anymore. And they were gone. And then I had one patient that she just didn't have a good story. Like I'm like 99% sure she wasn't hurt at work. It was too wishy-washy. She couldn't even pinpoint, like, we shouldn't have accepted her as a patient. Um, but I feel like we have a quicker turnaround, 30 days or less on almost everyone. And we don't get, uh, you know how like they haven't denied your case, but they're like asking for more information. Like we need more information to decide. We don't get that. Cool.
And if anybody wants to just unmute, you can talk. You don't have to necessarily type in all your questions.
Yeah, there's not very many of us on here, so I feel like we can have an open dialogue if we want. But really, if you're using those three prompts, you really shouldn't have to ask it a whole lot more. Like I said, I'm writing all the narratives for one of our clinics. Um, and I rarely ask anything in addition to those three buttons. The only time I'm maybe asking in an additional is if it has a real, um, patient has like a real weird diagnosis. They should pop up in your program. Troy, they should be on everybody's dashboard, right? Those three prompts. You need to unmute yourself.
If they're, yeah, they should be there. If they're not there, just let me know and I'll have our developer make sure that everything's turned on appropriately.
Yeah.
Because
So,
this was like like a 2.0 update. So I do want to make sure everybody is on the right version.
because that has made our life easier. In fact, my nurse practitioner at our Kansas City location, she does all the narratives, and I didn't tell her we were adding those. And then like a week later, she came back and she was like, "Oh my gosh, those have helped a ton." And part of it is just the act of having to type question in every time. Yes. Let's see if we open it again. One thing, like I will tell you guys, and I might have them add this, but just the very first prompt, the one where we ask, let me scroll down. Can you rewrite the medical description of injury with more detail, including all areas of complaint, explaining this question? If it's a CA-2, I do tweak this question, and that's the first prompt. And the only thing I tweak is I say, rewrite the medical description of injury with more detail, including all areas of complaint, expanding on the mechanism of injury. And instead of saying related to the incident, I say related to their job duties and the repetitive nature of it over the years. Like I just change that last sentence because, and I wanted to talk to our developer to maybe have a different prompt for CA-1 and CA-2 because it says incident, and sometimes it makes the AI like think it's an incident when we know a CA-2 maybe something that happened. And um, so also, and I know like not everything can be so perfect. Not every patient can come in and just have like this perfect CA-1 that happened like on this day, or this great CA-2 where they had this repetitive duty for so many years. I think I had a patient that she came in with her claim denied already from somewhere else, and she had filed a CA-1, but it's like her injury happened from everything that happened that whole day. So it's not like she fell and hurt her knee. It was an Amazon push day, and they had like a lot of extra parcels, and it was like a lot of heavy lifting all in one day. And so the way the doctor she went to before she came to us wrote it up, the examiner was like, this sounds like a CA-2, but it happened in one shift. So when I asked the questions, I knew this was already denied case. That first prompt, I had this there, but then I added to it. I said, this case has been denied because the examiner uh, doesn't realize that this happened in one shift. When you write this medical description, emphasize that this happened in this one shift, and it was from the repetitive nature of the Amazon push day. And then I hit enter, and then it made it nice. Okay, so Kevin, you ask, can you use this AI for the treatment notes as well? Yes. Yes, you can. So, um, and it just depends on the flow of your practice. I'll tell you how we use it in our practice in the flow. So, we have our patients come in, they see our nurse practitioner first. She does this initial exam and narrative, and then she'll refer them to physical therapy. They'll have their initial physical therapy eval, usually on like the next day or within the next couple days. We're putting them on the PT schedule for their initial eval. The physical therapist then has to write their initial PT eval, and in that it comes with some detail with treatment planning and creating a physical therapy plan of care. So we do use it for that. So how we use it is, our physical therapist will just come to our AI wizard, and he'll be maybe seeing John Doe a few days later. He'll just go in and then go to the bottom of that and then just say he presents for PT eval, and you got to put in your findings. He'll just paste in his findings. My findings show, and then he copies and pastes in, his exam. I'm not going to have any put in there, but will you write me, a PT plan of care for this patient with short-term and long-term goals? Man, if I could find some exam findings, I'd pop them right in there. Wonder if I could. I'll find some for y'all. Something fast. Let's see. Check it out. There's a lot there. Okay. There we go. What date was that? No, I don't want charges. Print chart. PT. There we go. Let's just put that in here. So we got some range of motion, we got some palpation. There we go. So we've got this patient presents for PT eval. My findings show this. Will you write me a PT plan of care with short-term and long-term goals? What I like about that is because in this inquiry, we already have the patient's whole backstory, their job description, their original injury, their medical eval, their entire narrative. And now I'm saying, okay, now they've had a PT eval and it showed this, write me this plan of care. So now I have this full PT plan of care with short-term, long-term goals, a plan. when the next progress eval is, what's recommended. And now my PT just goes in and copies and pastes this in his note. And you can expand on it too. You can say, will you write me specific exercises for phase 1 of treatment? And it'll probably tell you, it'll probably give you specific exercises you can paste in. So another thing that I've done, and actually I helped my team with this today, medical reevals. So they're showing up for their 30-day reeval. We just go in and we use it for that. Okay, so look, so now it just wrote, so for phase 1, got pelvic tilts, cat-cow, knee stress, forward bend, and it's basing all of this based on his injury, what his job is, and what he's needed for phase 1. So of course, the physician still needs to approve this, right? Because AI is not a doctor, but boy, it sure takes a lot of the work out of it, especially if you agree with all this. You're like, oh yeah, oh, I agree. Boom, copy, paste, done. Now that's in the note. So for medical reevals, my nurse practitioner will just come in and be like, patient presents for reeval. Today states improving with PT, still has, 5 out of 10 pain, especially with activity. So something as simple as that. Will you write me a medical summary for the assessment portion of today's visit? Include reference to their last PT reeval. Yeah, because it knows my PT put his reeval in here, right? Include reference to that last PT reeval. So now it's going to write a nice little summary. So when my nurse practitioner goes in and does her reeval note, she's going to put in their subjective complaint, obviously any of her exam findings for that day. And then in that little section in Quick EMR where it says medical summary for the reeval note, she can put this. He reports this. Here's the objective findings, and it's going off of what the PT found, in their last reeval that they did on him. He demonstrates positive progress in his rehab program, improved range of motion, muscle spasm, enhanced posture. His discomfort has decreased. Favorable response to PT interventions. Reduced guarding. He suggests therapeutic exercise techniques are effective. Continue with current PT regimen, introduce more advanced exercises, monitor discomfort. Compared to the last PT eval, he's shown significant improvement. I'm like, that's great. Oh my gosh, copy. And I'm pasting in, their medical reeval. So if they had a medical reeval note, I'm putting that right here. Paste. Boom. Then of course you paste over your diagnosis. You put in your own exam right there. But yeah, we use it for a lot of that. And feel free to, here's the thing, those first 3 prompts, write your initial narrative, and then ask it anything. It's AI. Like we've trained it on OWCP, we've trained it on all of that stuff. So if you think about it, ask it. What do you say? I would think you could get medical necessity for PT. You definitely can. So let's say this guy has that last PT reeval in there. It's got this. We've actually used it for when we start getting denied pre-auth for PT based on medical necessity. Say his last pre-auth for PT was denied. Can you write me a letter of medical necessity for physical therapy for him? And then it's going to pull out from that patient's exam findings, from their progress so far, from their job description, from everything, and write a nice letter of medical necessity for the reason for PT. I've done that just a handful of times actually recently. And what's nice is this is archived. So it's not like you're having to go to AI, build a new inquiry, put all that patient's information in, and then ask it for this. It already knows it because it's in there. So now it's saying, here's this. I'm running to appeal the recent denial of pre-authorization for PT. This patient is under my care for all these problems. And in my professional opinion, that ongoing PT is medically necessary for him to achieve optimal recovery. Here's his current history. Despite these improvements, he continues to experience discomfort, particularly during activities, which undergoes the need for continued therapeutic intervention. Here's his objective findings, rationale for PT, restore function. I mean, it's got it all in there, and then in a conclusion. And of course, you can have it take out the stars and stuff, but I would just copy, dude, put this on letterhead and have it sent in. And if you wanted to expand on this, you could say, you'd be like, can you put more detail? Can you put more emphasis on his functional impairments instead of symptomatic? Yeah, maybe because we know DOL doesn't give a crap if he's in pain. They want to know, is he functionally impaired? So maybe this letter of medical necessity needs to be more about that instead of the other. So let's rewrite it and let's focus more on like what's functionally impaired instead of his pain. Yeah, so we'll rewrite it and we'll put it on that. He's shown improvements, however, he continues to experience functional limitations that impede his ability to perform his essential tasks. That sounds better. That might appeal to their nature more. Yeah, could definitely use it for that too. But all of this is going to become valuable as long as that initial narrative that you wrote is good. And you have that in there, and then you can start adding more information to it and then get your whole team involved. So full circle in the office, everybody's getting more efficient, not only more efficient with their notes, more compliant, and better information. Any other questions? The only critique I'll give about the wizard is that it uses work like can or often, which I need to catch before submitting my notes. I agree. It's not perfect. It doesn't do it all the time, but it does do it sometimes. I've actually had narratives where it'll throw the word likely or it's probable, and that's why you do need to read it. And then all I do is just say, I'll come down and say, oh man, we had a lot here. This is great. Can you rewrite and do not use any ambiguous language like the word likely or probable, and hit send, and then it rewrites it. So you just have to watch it, and then you just got to say, hey, this is great. Rewrite this. Don't use that word. How long does it stay in the system? Forever. It's going to be there. It's going to be archived forever for you to reference it. I will say that as I've been going through, like the more straightforward the patient's injury is and the better your exam findings are, the less that AI gives me those words, like it's probable or it's likely. But every once in a while we get a patient that like maybe has a CA-2 or mostly CA-2s where it's like, yeah, I developed this over time, but it's not like real clear. And then maybe your exam findings are like, you're not like finding hardcore exam findings like orthopedics or things that prove that happened. You'll get more of that. So I would say the more detailed that patient description of injury and what happened is, and then the better your exam findings are, the less you'll get, those probables and stuff like that. Cool. Awesome. Very good. Yeah, and I always say like with AI, like just be logical with it. And I almost sometimes like pretend like it's a person and I talk to it. So like when I come down here, like sometimes I even I don't often with this, but like with other AI and stuff, like I can get sassy, like if it just says things and I'm like, okay, I said don't use this word, don't use, and it'll be like, okay, I'm sorry, and then it'll do it right. But just I talk to it like it's a person, like rewrite this and add this, rewrite this and say it more like that. What kind of files would be uploaded with the upload button? Good. Actually, I used the upload button a couple times today doing I was medical reevals we were helping chart. So I had two patients that had medical reevals that just saw the orthopedic surgeon a few days before their medical reeval visit. And the orthopedic surgeon had sent over his notes from his visit with the patient. So I uploaded here, uploaded the orthopedic surgeon's visit. And then I put in the question here, right? So I uploaded the orthopedic surgeon's visit and then I said, patient presents for re-eval, saw ortho on, this date. The ortho visit is attached. Use the info in this visit and write me a medical summary for the assessment portion of my note. And I did that. And then it pulled the information from that ortho's visit. The ortho did an exam, the ortho made recommendations all in there. And then it put it in my nurse practitioner's medical summary for her reeval visit, what the ortho was recommending, and put that in there. So I use it like that. Other things I've used the uploader for, obviously, if the patient has a reconsideration or even the denial for medical necessity. Upload the denial for medical necessity and then just say, we received this denial for medical necessity for PT. Will you write me a letter of medical necessity for this patient? And you've uploaded that denial for medical necessity. I've uploaded requests for reconsideration or not that. If we have a denial letter, I've uploaded that or request for more information. Upload, patient received this request for more information on their claim from DOL. It's attached. Use the information in this to write me a, new narrative or new this. So those are examples of that. Mm-hmm. Do you use the upload prompt to write a rebuttal to an IME doctor? Ooh, that's a good question. I've never had to yet, but I bet you could, especially if this has all your patient's information and their exam and all of its opinion on what happened. I would totally upload that and then say, this patient saw an IME doctor. Here's their opinion. Will you write me a rebuttal to this based on the patient's information we have here? And then I've never done it, so I can't tell you what it's going to say, but I imagine it's going to at least help you with that. Yeah, I think we're learning more and more the more we use this, the more situations that arise in our practice and things that, happen that you can upload and use in here for sure. Or if patient comes in with some medical records from another doctor, right? Like, oh, I saw, some other specialist and here's their medical records. Upload it and, write me a summary for today's visit, reviewing these findings with the patient. Summary there. Very good. So was this helpful? Are you guys finding this helpful? Awesome. Good. Um, and I don't know, I'm gonna put in the chat. I don't know if all of you guys have my personal email, but I'll give you my personal email. But feel free to email me anytime if you have a question or you're running into an issue. Like just email me and I'll do my best to help you when I can. Or if you find a cool thing that it helped you with and you don't think maybe I don't know about it, let me know. Because I'm still running 2 practices and I can get more efficient um, for sure. And I mean, it's like I learn something new about our EMR every day, and we've had the same EMR for 14 years. So there's always something new to learn, especially with AI. Well, good. Well, one last, okay, so is there anything else? And we'll wrap this up and then we'll save this recording. And actually what we should do is put this recording on, Troy, we should put it on the site. So everybody knows that over here for videos, this is where we have a training video. It's the very first one I made. So we'll upload this training video to here too. So if you guys got other team members in your practice that need to see it, or if you want to recap it, you can. Okay, very good. Well, I appreciate you all. This has been good. Hopefully you got some good nuggets from there. And you got my email, so email me if you have any follow-up questions and we'll keep rocking it. Okay, very good. Talk to you guys soon.